Let's talk about anti-constipation drugs. Anti-constipation drugs. What do we have? We have the bulk forming laxatives like methyl cellulose and xylem or psyllium, whatever. But they are the soluble fiber methyl cellulose. They're the bulk forming, like they form the bulk. They are the soluble fibers that draw water into the gut lumen, forming viscous liquid that promotes peristalsis. Anti-constipation, relieving constipation. These are all the drugs. But the adverse effect is because you have all the fluid coming down into your gut, causing bloating. Osmotic laxative. Osmotic is lactulose, also given in hepatic encephalopathy. Magnesium citrate, magnesium hydroxide. So magnesium citrate hydroxide or polyethylene glycol. They provide osmotic load to draw water into the lumen. Well, the other ones were the fibers that were drawing the water into the lumen, and these guys are osmotically so much active that they're drawing the water into the lumen. Lactulose also treats hepatic and calf gut microbiota, decreases lactulose into metabolites like lactic acid and acetic acid that promotes nitrogen excretion as an H4 by trapping it in colon. Okay. Adverse effects is diarrhea, and if you want to, let's just talk about diarrhea, dehydration, and maybe misuse by patients with bulimics, bulimia. Okay, now stimulant relaxant. Now you are trying to stimulate the gut to have the contraction, so which is bisacodyl and Sena. You give Sena, it causes enteric nerve stimulation, causes colonic contractions, leads to diarrhea. Or you can give some emollient laxative like Ducosate. What is Ducosate doing? Well, Ducosate, it is a surfactant that decreases stool surface tension. Wow. Decreases stool surface tension. Wow. Promotes water into the stools. Wow. What a mechanism. And relieves diarrhea. Again, surface tension of stools decreased. Water is more like getting attached with the stools, leading to nicely diarrhea. Lubiprostone. That lubiprostone, it's a chloride channel activator. Chloride channel activator leads to an increase in intestinal fluid secretion and causes diarrhea and nausea. Okay. Let's talk about this. The other one. Guanylate cyclase agonist like linaclotide, placanatide. Well, it activates intracellular cyclic GMP signaling, causes increase in fluid and electrolyte secretion in the intestinal lumen. Again, simple thing. Name, guanylate cyclase C, activates cyclic GMP, causes more fluid and electrolyte comes to the lumen just by activating the cyclic GMP. Causes diarrhea, bloating, abdominal pain, discomfort, flatulence. Serotonergic agonist like prucalopride. They are the 5-HT4 agonism, serotonergic agonism, which leads to enteric nerve stimulation, leads to increase in peristalsis and increase in secretion. Again, diarrhea, abdominal pain, nausea, headache. NH3 inhibitors. They are the tenapanor. Tenapanor inhibits the sodium hydrogen exchanger, leads to decrease in sodium absorption. So sodium remains in the lumen, causes increase in water secretion into the lumen, causes diarrhea, abdominal pain, nausea. Okay, so that's all for the anti constipation drugs.